ChartTalk gets its information from eThomas. To enter a new patient, go into eThomas and select New. We'll enter all the patient demographic data, and when you're finished, the product will go over to ChartTalk seamlessly. So it's first name, last name. The information you enter pertinent to ChartTalk will be moved over there seamlessly. When you're finished entering the information, go to the lower left-hand corner and click Save. You see the patient's information in eThomas. When you flip over to ChartTalk, you'll see the patient's information. If we click Patients, in the first couple letters, we see that Margaret Bundy has shown up in ChartTalk with all the information. If we want to modify a patient, we should do that in Genius as well, because Genius feeds the patient demographics into ChartTalk. So if we open Genius and we select Patient, we can access the patient's information for editing. Here we're just going to make a minor change to their address from Oak Street to Mighty Oak Street. You'll see everything, all the information Genius passes to ChartTalk indicates if it's a modified record, new record, all in the HL7 messaging standard. So here we see that the address has been changed in Genius. Now in ChartTalk, if we go back to Patients, we see that Margaret Bundy's address has indeed been updated. Let's look at how the schedules in ChartTalk and eThomas can synchronize. You'll see here is the blank schedule for the 16th of November in ChartTalk. Same with eThomas. Now let's schedule an appointment. We'll pick our patient. We'll use our Margaret Bundy. Click Save. You'll see it on the eThomas schedule. If we go back to ChartTalk, every 20 seconds, ChartTalk scans the eThomas directory for new and modified appointments. So within 20 seconds, you will see the appointment appear within ChartTalk. Using the same appointment, let's change the time of the appointment. With eThomas, you can just go in, select the appointment, and change the time by dragging the appointment to the proper slot. Select Yes, and eThomas marks that record as modified. So ChartTalk again will scan the directory every 20 seconds and move it to the proper time, adjusting it and keeping the today's visit. Let's say instead of a time change, the patient needs to see another doctor. Open the schedule in eThomas, select the proper physician, select Save. You don't see much of a difference on the eThomas schedule, but as you see, the columns for Stephen Smith and Paul Kelly indicate which provider will see the patient, and every 20 seconds ChartTalk updates the record. The ability to delete an appointment from the schedule is easy as well. Let's go back to the eThomas schedule. If you right-click on the appointment, you will get some options. When you select Remove, it removes it from the eThomas schedule. And if we go back to ChartTalk, you see that was pretty close on our 20-second cycle. We'll go over creating a new note in ChartTalk and then sending the diagnosis, and procedural codes back to Genius. As you see here on the schedule, we have a 4:30 appointment for Cassidy Anderson. If you look along the top, you'll see that we've already selected Cassidy Anderson as a patient. From the patient screen, you can see Cassidy Anderson's information. So she's got all of her meaningful use information, so let's move forward. If we click Visits, we can get to the visit screen, and you see there's a blank note for today's visit. And you'll see the active diagnosis codes from the previous visit show up on the right side of the screen. So let's take a look at what we did previously with Cassidy Anderson. Get previous SOAP. That's a smart command that'll import all the previous SOAP information from the note to quickly review. We can see, okay, L4, L5 in the SI joint. Pain was sharp and shooting. And the pain rating was a 5. So let's modify that information. Select all. Delete that. Miss Anderson presents return in 2 weeks for a reevaluation. PRN. Okay, so we've made our note. Now let's document what we did for the day. So if we right-click on the CPT codes, we can add a procedure. And let's say this was a re-exam, 99212. So we'll select our procedure and select OK. So as we see, we've got the patient was seen by, alerts. When we say save, we save the visit, and the checkbox is enabled and allows us to send it right over to Genius for billing. Here as well, if you've got more than one procedure, more than one diagnosis, you can highlight and use these up and down arrows to adjust the primary diagnosis as well as the CPT codes. So now if we go over to Genius, we'll take a look. And we'll just send it right over here by hitting this checkbox. Now if we go over to Genius, we'll go into the Cassidy Anderson. We can click on her name right from the schedule. Select OK. And check Post Charges. And you'll see there's our charges. So integrating the two systems is that seamless with Dragon Medical, eThomas, and ChartTalk, the speech recognition EHR.